Now I'm going to introduce another Canadian. Heather Hargraves is one of the co-founders of Divergence Neuro, cloud-based software platform that allows clinicians to offer neurofeedback and neuromeditation therapies from a distance. Heather is also resident scientist for Divergence Neuro, neuromeditation instructor with the Neuromeditation Institute. And she works in London, Ontario, Canada. Heather had many different professions before that. And at the moment, she's actually interested in researching and investigating the neurological underpinnings of various states of consciousness, including dissociation, meditation, psychedelics, and various polyphasic states of consciousness associated with various practices using altered states as a vehicle for healing. So it's going to be very, very interesting. Her master research focuses on the therapies induction of altered states of consciousness based on research findings related to psilocybin, which is, we pretty much know, magic mushrooms. Prior to her training as a neurofeedback therapist, Heather worked as yoga and meditation instructor, as well as reflexologist, Thai massage therapist. And it was her personal experience with these modalities that inspired Heather to pursue further studies as a therapist, with focus towards understanding the neurological underpinnings of these body-mind therapies. Currently, Heather is an advocate for the interface of neurofeedback modalities with psychedelic therapies, with an emphasis of the preparation and integration periods, the broken psychedelic therapies, and they are to be basically legalized. We know a little bit about what's going on in Australia in terms of psychedelics and research, so it's very, very, it's my pleasure to introduce Heather. So it's all, floor is yours. Thank you.
Thank you. Thank you very much for inviting me here. And I'm honored to be speaking with everybody that's at this conference. I actually got my start in Ruth's lab with Dr. Paul Fruin. And that's where I did research on psychedelic informed neurofeedback, which was actually kind of born out of the Alpha Down study. So I owe a lot of my knowledge and experience to my time in her lab, and I'm grateful for her ongoing research because it continually inspires my understanding. And I also want to thank Seaburn Fisher for her mentorship and guidance along the way. I took, I understood the neuroscience from Ruth, and Seaburn really helped me understand the relational side of this. And I would say the interweaving of those has kind of brought me here today. So I'm really excited to share this with everyone. Let's see the slides. There we go. So I'm going to take us on a journey into self through relational technology in theory. I have started to use neurofeedback in a way that I see it as a relational tool. And I want to share with you guys today how I work with it that way, and also how I feel that is a helpful method or theory that we can start bringing neurofeedback theory into the realm of psychedelic research to help individuals better understand the journey they're about to go on. How do we prepare them for that journey and integrate them with that journey? So when I first started as a clinician, I did have some neurofeedback in my toolbox, thankfully, because of my research. But for the most part, I had been trained in talk therapy. And many of us who work with clients, understand that first session, and I'm sitting in my office here today, so I feel wrapped in my experience with my clients at this moment. We're trying to get the clients to understand, yeah, but what are you actually feeling? And this person sitting here with the cloud over their head is where a lot of people start. That is why they have come to us. And I've learned that just talking to individuals can be a very tricky way of getting them to understand that, because if talking to themselves was the way, they would have talked themselves in already, because most of them are spending a lot of time in their heads and not necessarily in their bodies. And this is really highlighted in some of the psychedelic talks I've seen. So I entered the psychedelic field probably in 2015 is when I started my research. Prior to that, I'd been doing research with Dr. Fruin on mindfulness, and we were looking at state measures of mindfulness. And as I was presenting the psychedelic infused or informed neurofeedback practice, it just having that framework of brainwaves and different networks and the neuroscience of it, I think allowed me to look at some of the psychedelic research in a different or a little bit of a novel way that kind of brought me here to see, like, I really think that our community and that the neurofeedback practices in general are just so well poised for really helping and guiding the psychedelic community in more ways than one. And Dr. Rosalind Watts, who's from Imperial College and has done quite a bit of research in this area, is really ACT-based in the way she practices. And she's developed this psychological flexibility model and a theory that outlines, you know, what do people get from psychedelic sessions and what is it that they're experiencing and what is important for them to come out of the psychedelic experience with for it to be profound and meaningful. And during one of her talks, she was explaining this image here, and she was saying, well, we bring people, you know, to the water and they take the substance, and we're asking them to let go, to sense, to allow all that somatic content, you know, as the prefrontal shuts down and they go deeper into these theta states, to sense and then to feel. And through that feeling, they get to this place where they find this pearl. And that pearl represents, you know, that beginning of that mystical experience that you hear talked about as this thing that needs to happen in a psychedelic experience for people to have that long-term change or insight. And she says they need to take that pearl and bring it up to the self, and there they find meaning and intention, and then we work that forward. But she said that's actually really hard. We've actually noticed that bringing people to the water and getting them to dive in is trickier than we thought. So they've talked a lot about different mindfulness techniques and ways of doing that. And as I listened to her speaking, I said, oh, you're taking people from beta into alpha, into theta, down into delta, and we're trying to move them through the nervous system, move them from externalized awareness into the subconscious state where most of them have resisted. And Ruth's work in particular, all the alpha research is really that bridge. You know, alpha is the bridge between the conscious and the subconscious mind, my external self and my internal self. And a lot of people don't have a good bridge. And so not only is it hard for them to cross the bridge to get in, it's hard for them to cross the bridge to get out and to have that pearl and to do something with it. At another conference over COVID, there was many online, and I was lucky to meet Shinzen Young at one of them and have a conversation with him. And I was speaking with him about, and he's a Buddhist meditator and researcher, and he's written a few books on the topic. And I was explaining to him a lot of the neurofeedback theory, and he posed a koan to me that actually really inspired some of the way I started working with clients, where he said, you know, well, what is the difference between the fire that burns and the fire that warms? And I really sat with that. You know, what's the difference between feeling arousal in a way that leaves you feeling frustrated, distressed, and annoyed versus astonished, excited, and happy and delighted? On the other end, what's the difference between the water that's refreshing, the cold water that refreshes our system, and the thing that freezes us and overwhelms us? So as I started thinking about that more, I started framing to my clients this idea that this is emotional cardio. You are genuinely learning how to progressively overload your nervous system in a direction where you can translate these unpleasant feelings into pleasant feelings, much like Ruth was talking about, you know, that discernment and separation from these enmeshed states into this ability to discern, is this unpleasant because it's crossing my boundaries, my values, you know, who I am, my sense of self? Or is it unpleasant because I'm actually growing, because I'm moving towards change, and change is emotional cardio, and that is challenging, but that doesn't mean we move away from it. And I find when individuals are highly enmeshed and alexithymic, that can be a pivot point that they really, really struggle with. So as I'm working with clients clinically, also using somatic modalities, neurofeedback, and cognitive modalities, I'm always trying to keep in mind that it's emotional cardio for people, and that discernment between what burns and what warms is something we want to keep context for as we travel through therapy. And as we are doing that, we'll take a page out of Carl Rogers' work, where he said, in my early professional years, I was asking the question, how can I treat or cure or change this person? And he said, now I would phrase the question in this way: how can I provide a relationship which this person may use for his own personal growth? And this was really echoed when I was working with Seaburn, who talked about, even the way you put your hands on someone's head is part of that therapeutic alliance. This is not something you are doing to someone. Do not talk to your client and say, I'm doing this thing to you. You are sharing an experience with them, and together you are understanding what happens when we make this change. And I've really found that this technology is so wonderful for helping me develop a therapeutic alliance that's objective, co-created, allows me to be humble, and allows the client to be seen. Because I will see a change in one of their frequencies, depending on whatever it is we're doing. And then we can have this conversation about what has changed in your state, what has changed in your awareness, what has changed in your sense of self. Fine-tuning that discernment, that safety, that attachment to self, that attachment to me as a therapist, defining that therapeutic alliance, but being mediated through a technology that helps us be objective and kind of scientific at the same time, which I find with clients who really have deep developmental trauma, developing that trust can be really challenging. And I have found the technology a really wonderful mediator of trust. So framing it that way and going on this journey into self and thinking of Rosalind Watt's work, where we want to be able to bring people into that place where they can dive down into the subconscious, find something meaningful and insight, and come out with it. More and more individuals have been turning to mindfulness. And this is what Rosalind Watt is using too. The ACT theory, a lot of mindfulness is a part of that. And how do we use mindfulness combined with psychedelics was a topic of this paper in 2021, combining psychedelics and mindfulness intervention strategies to inform clinical practice. And so I read this paper and I thought it was really interesting, but I felt that there was a piece missing. So at first they say that psychedelics are the compass. Psychedelics allow us to steer, to go deeper, to get into the water, to get into the lake, to start, focusing on our work and where it is that we want to go. And then they argued that mindfulness is a vehicle. Mindfulness allows us to integrate, to generalize, to maintain our practice, to prepare us pre and post, and to go deeper. And they said these two synergistically together really allow what Rosalind is hoping for, what many clinicians are hoping for, that softening of the ego, increasing allowing so that people can get more out of psychedelic experience. And they argue that psychedelics can also help individuals go deeper with their mindfulness practice. And I would agree that this is very true. But I feel there's a piece missing. How do you know where you've been? How do you know where you're going? How are you tracking that journey? What is the map? And how do you know you're not just driving in circles? So I would argue that the neurofeedback community is really well poised for offering objective assessment with EEG to help individuals track their journey, deepen their journey, and expand the map of their inner state and where they want to go. Because psychedelics are not a magic bullet on their own. And right now they're expensive. They require a lot of preparation and integration. Set and setting really needs to be in place, and you need a lot of highly trained professionals. And I wonder if we start adding EEG assessments and EEG tracking, is it possible that we could actually start streamlining these practices, streamlining these therapies, and supporting clinics in ensuring that individuals are ready for a session and that their integration is actually going as planned? Because pivotal mental states, which everybody is talking about in the psychedelic community, or Robin Carhart-Harris always talks about the Rebus model too, relaxed beliefs under psychedelics, or these hyperplastic states that aid rapid and deep learning that can mediate psychological transformation. It's a tool, it's a useful state, but what are we doing with that state? How do we really make the most of this state? So I would argue that if we start integrating EEG and neurofeedback into psychedelic practices, we're going to be well equipped for tracking how prepared the brain and nervous system is for the shift that we experience during a psychedelic session, to take advantage of the increased flexibility created by the experience and offering added guidance before and after these sessions, giving people mental state training, shifting away from just a mindfulness practice, which someone may or may not be entering into. I know many of us who work in the neurofeedback community have had individuals who are meditators come and sit, we put the cap on their head, and sometimes they're not actually practicing that state. They think they are, but they haven't quite learned some of those subtle, shifts in awareness. And when we give them that little shift with feedback, they can truly deepen their practice for the first time. It's a mirror that can be really, really helpful. And we can track, assess, validate, educate, improve, and inform these therapeutic modalities with more evidence from EEG. So this brings me to the importance of states and the importance of having therapies that prepare individuals and integrate individuals for something that is going to be a journey in states. Talking about it is not enough. And a lot of psychedelic therapists that I know, both above and below ground, and some of the trainings will integrate things like photic biomodulation. Holotropic breathwork is a really well-known one that puts people into these theta states and kind of drops the alpha bridge as well and gives them a sense of what a psychedelic journey might be. Varieties of breathwork are used, varieties of somatic practices are used. But again, it's still left to the individual to kind of guess at if they're entering the state or not, or they don't always know exactly what that state was and how do I find it again. And we want to move people away from protection, fixed beliefs, isolation, and alexithymia into psychological flexibility, which is transitioning, connecting, and that deep, rich understanding of emotion from an embodied place. So Jake Aday and colleagues, Alan Davis, folks that I've met in the community, came up with this paper, and I was very excited because they were wanting to predict reactions to psychedelic drugs, and they did a systematic review of states and traits related to these acute drug effects. And they found that the states of absorption, openness, acceptance, and surrender were more likely tied to pivotal mental states or the mystical effects of a psychedelic experience, whereas preoccupation, apprehension, and confusion were indicators that somebody was likely not ready for a psychedelic experience. And this just, struck me because when I was doing my research at Western, a lot of the research on mindfulness was looking at, trait measures of mindfulness. And they always focused on, we want to see these traits of absorption, openness, acceptance, and surrender increasing across these different measures. But Dr. Fruin was saying, but nobody's actually measuring the state. Like, how do you know you're actually practicing the state? And that was part of what the research we were doing, was creating a state measure and metric to understand that. And then later with the neurofeedback, actually employing that a little bit more. And Jake Aday and colleagues stated that if states and traits that facilitate the benefits of psychedelics become firmly established, which they more or less did with this paper, then a natural question will be how to alter those baseline variables to enhance treatment effects. And I'm just sitting here, well, neurofeedback, of course, this is the way, like we can actually, that is what we do. We alter these baseline variables and we enhance treatment effects in psychotherapy already. So why would it not easily translate into psychedelics, especially given that those are state shifting medicines? So I've been proposing, I'm going to propose here, and I've kind of been talking about this at psychedelic conferences for several years now, that using neurofeedback and neuromeditation to attune our embodied awareness can help us highlight and cultivate a deeper relationship with the aspects and states of self-awareness that are better situated to allow us to have that pearl when we get into a psychedelic experience. So the type of state education that I've been offering and that I've been teaching and learning since about 2017 when I met Dr. Tarrant and did my first training with him in neuromeditation include 4 different states that are derived from the neuroscience literature on mindfulness. And since he's come up with these, more research has come out that I'm happy to share that further validate that these 4 are indeed productive and continually show up in the literature. And what I really like about them is that, you know, I heard a lot of individuals talking about alpha down and how alpha down can lead to some uncomfortable outcomes for certain individuals, particularly those ones who are high in alpha, and that's that guarded state, which I'm actually going to talk about a little bit more. And I have found that by placing alpha down where it's needed within this overall architecture can help minimize the likelihood of someone kind of falling off the cliff or having too overwhelming of an experience with neurofeedback, because I'm bringing them along and educating them on these shifts in state using this kind of architecture that Dr. Tarrant created. So we have focus, which is we consider is activating and is often used for ADHD, but most mindfulness practices do begin with a focus. They get individuals to, you know, hold their attention in one place so that then you can start discerning or noticing more subtle changes in yourself, in your awareness, in your insight, in your emotions, that if you can't start there, it becomes really difficult to progress deeper into state awareness or other types of mindfulness. So actually, we use alpha down as part of our focus protocol. It's an eyes open interface. We use a fire. I will show images of that as we go on. And essentially, as somebody lowers their alpha, the fire gets bigger and the crackling gets louder. But we've also offer YouTube now, so there is a dimmer screen. So I do find that that can be extremely helpful when somebody is first learning to state discern. And what I like about the dimmer screen or the fire growing or getting smaller is that I can have more of a conversation with them. And that's what's a little bit different, I think. I think lots of neurofeedback therapists will do this, but it is primary to the neuromeditation theory that you are conversing with the person during the neurofeedback. So as I notice them shifting states, I will pause and have a conversation on what changed here. I want to really emphasize that discernment so that they recognize when things are changing. The other one that I'll kind of balance that with tends to be quiet mind. So one is alpha down and the other one is alpha up. I'm always building that alpha bridge, playing with this ability to modulate alpha so that the strength of that bridge is there. So when somebody's moving between states, they have a little bit more of a foundation to do that. And so we will, it's an eyes closed meditation for this one, and it's an increasing of alpha 1, much like Joe Camilla did and what everybody was really excited about in the 70s. But I find placed within this overall architecture, it can be really helpful. So mindfulness, I'm going to get to in a couple of slides, but this is really when we start working with embodiment and that awareness of the body. And this can be such a pivotal piece in really building a solid alpha bridge and enhancing focus so that once that somatic awareness becomes strengthened, people can really start to settle into all 3 of these states. And we actually see within the neuromeditation theory that open heart is a very advanced practice. Asking someone to embody compassion if they can't focus, if they can't feel, and they can't quiet their mind is literally like asking them to jump over a precipice. Like there is no bridge there. And research has shown that if you compare depressed individuals who are actively ruminating versus individuals who are not actively ruminating, and you gave them like an open focus, a focus practice versus a compassion practice, those who are still active in rumination need focus. But they don't get as much from focus when they've quieted their mind, they're a little more mindful, and they can hold their attention. That's when they start to get a lot from a compassion meditation. So we have a quiz on the neuromeditation website. And as clinicians start working with this, we ask their clients to take that quiz, and it begins a conversation. And you get a sense of where might your client be struggling, and where would you start with a neurofeedback protocol or a neuromeditation practice. Another way that we educate at the Neuromeditation Institute, and I really like that Ruth has the little brain on the bike, is we actually use the idea of a bike to teach how individuals are using emotional cardio to move through the intrinsic connectivity networks. Because it's not just brain waves, and it's not just states, but it's also those like capacities that come when you start embodying certain traits. So the default mode network, for example, we see as the bike. It is the foundation. If your tires are not pumped and your chain is broken and you've got, a frame or a seat, the frame that's bent or a seat that's too low, it's going to be really hard for you to ride this bike. And if we identify that the default mode network is one of the core challenges, which is that bridge and that alpha rhythm that someone's having, I try to destigmatize that and just say, okay, so we're just going to work on a tune-up. We are going to tune up this part of your brain so that it's easier for you to ride the bike and it's easier for you to get where you want to go. As individuals tend to practice, and this is again, that focused and quiet mind dance, I usually start seeing more acceptance and equanimity in them. That acceptance and equanimity is really what is needed for the salience network to be able to balance well on this bike. Then I can start working into the mindfulness category a little bit more, possibly some open heart, and we start working on sensory clarity and openness. Now that the DMN is a little more regulated, we can start getting that person on the bike to feel more relaxed, more comfortable, and then as a result, they get more experience riding the bike and they deepen their relationship with their bike, and they get better at identifying when the bike is out of tune and not necessarily getting too caught up in like identifying which states they need to practice in order to be able to ride the bike with more comfort, and also identifying when the bike rider is getting exhausted and needs to take a break. When the bike is well attuned and the bike rider is comfortable, then we start seeing more concentration power and curiosity. So then we know that the central executive is starting to come online. In a clinical population, one of my mentors, Ed Hamlin, had told me a long time ago that in a clinical population, we're seeing 70% of the brain is actually oriented inwards, and only 30% is oriented outwards. And so we're trying to shift that. And what I've seen is that when that shift starts happening, as I walk people through these modalities and try to educate them on what is happening in their nervous system and why they need to practice certain states or why I'm doing a certain neurofeedback protocol, we start seeing more acceptance, openness to experience, and curiosity, as well as the ability to focus, which says to me we've kind of met that threshold and we've shifted gears. It also means that individuals are starting to develop more state or psychological flexibility. They can move from beta through alpha to theta and delta with more comfort and less reactivity overall. Something that was really exciting for me when Jeff kind of discovered this was that there's actually two forms of mindfulness, and that the way we reward these in the brain is quite different. And this actually has been incredibly helpful for me in working with those individuals in particular who have that high alpha frequency, Because if you actually start with gamma in the posterior cingulate and just play with the gamma frequency, they have less of a reaction. The more frequencies you involve, and especially alpha, my experience is like a plunger for the subconscious. It just starts pulling stuff up. And if people aren't quite ready to handle that embodied content, that's when they become overwhelmed. And this is what I've heard other folks talking about today. So the way I've learned to titrate that a little bit is to play with gamma at the posterior cingulate first. Then I can start moving into an alpha, or I'll talk about the deep states protocol that I worked on during my master's. But there are two forms of mindfulness. And as people are moving through those states of consciousness or brainwaves, like outward to inward, they'll be better at one or the other. So another way that I'll describe, go back to here, this conscious and subconscious state is some people are kind of like paracellers and they hang up above the alpha bridge. And some people are like deep sea divers and they hang out below the alpha bridge. And I just tell my clients, they really just want you to be able to float on the surface, like hang out in the middle. And so you can move up or move down. You have your default where you idle, and that's okay. We're all different. But you really need to be able to find that middle ground and either come down or come up with comfort before you can really get that full range of states. So when I'm working with mindfulness in particular, and we're starting to really work on that like alexithymic response, and I do bring a lot of like DBR and somatic work into this process as well. There's directed awareness, which is more a body scan, progressive muscle relaxation, healing imagery like body and chakras. And we actually increase gamma in the insula and increase gamma in the posterior cingulate. So the ego is still active, and you're developing an awareness or a self that is starting to understand and look at the body, but that's still kind of like from that top-down perspective. As they get more comfortable with this, as their focus improves, and as their regulation of alpha improves, we can start moving into non-directed awareness, which is what most of us understand mindfulness to be, and what a lot of people think they have to do off the hop, which is really hard, is to sit there with effortless awareness, choiceless awareness, and just this experiential focus where the mind is quiet. And to really encourage a client to do this, we actually increase frontal midline theta in the cingulate, and you start to decrease gamma in the posterior cingulate. So that selfing kind of comes down, and that just noticing increases. And I've really had a few clients who are more OCD. It's taken them time to get here, but you can just see they have this sense of the room opening up, and they describe it as like, well, they struggle for words at first, but there's just this widening of their lens that can be really cool. And that brings me to a lot of Janina Fisher's work, who I also really value. And this is probably, of all of her slides, the one that I will show my clients the most, where I'm really trying to help them understand that that noticing brain is so important. That we can't judge or think or, top down our way into giving the body a felt sense of safety. We instead have to notice, and with parts work, this is why we start working with parts, so we can notice something and have a relationship with it that then changes our relationship with our internal self, which has a lot to do with that bike rider being on the bike and then noticing that they're riding a bike at all, or that they even have somewhere they can go. So the research that I did in Ruth's lab was mimicking psilocybin. And we had noticed that the way the default mode network was reacting under psychedelics was very similar to what we were seeing with individuals who were dissociative. That was very interesting and curious. And so we wondered, well, what happens if we broaden a squash? So it's a basic squash where we take everything from 1 to 20. Oh, here we have it up to 30. You can go higher if you like, but my research was to 20. And as you bring all the frequencies down, what happens? And we actually, the research showed that it was not unlike what people get from microdosing, because, and I'll show you in a moment, psychedelics do the same thing. They drop alpha, and then there's a rebound effect to that. But what's really interesting for me is that comparing alpha down with the deep states protocol is there is a bit more of a gentle feeling to it. I find people don't quite get as reactive. So I will sometimes use this one, or I will use just gamma in the beginning. And because I'm using a dimmer screen and having a conversation with them, I really want to teach them that what you are learning is that difference between being out of your head, being in your head, being out of your head, being in your head. What does that feel like? And it's diagnostic too, because the clients who can notice that already have that capacity. But the clients who can't see that, that really indicates to me how fused they are with their sense of, or their emotions, and struggling with a sense of self. What Jeff has done at the Neuromeditation Institute, which is really cool, is that we actually broke the bands down. And this came from suggestions from a few individuals. I think Seaburn commented on this before, and Ed Hamlin commented on this, that aren't the slower frequencies contributing more to the signal? And okay, that's a really valid point. So when we break them down smaller, you can also see which bandwidth someone is struggling in. And sometimes that gives you a little bit of an indication of where they're struggling in their sense of self. And then you can independently threshold each of those bands. And that can also lead to less reactivity from my clinical experiences and a few colleagues around me. So when I think about brainwaves, states, and awareness, I'm kind of always drawn back to Anna Wise's work and, with the awakened mind. And I really, really loved the way that she conceptualized how brainwaves are functioning with respect to our awareness. So she said, Delta provides unconscious intuition and insight. That is our orienting response. How strong that Delta frequency is can tell you a lot about how vigilant someone is, where their awareness is going, how their intuition is functioning. Then Theta offers deep subconscious understanding and awareness, that comfortable bike ride, the person really being able to balance. Alpha wraps the lucidity of imagery around the content so that it can be experienced. And that's like that pearl, taking that pearl, bringing it up. We need to have that strong alpha bridge to have that insight and that mystical experience. And then beta adds conceptual interpretation and explanation in words. And all of these are needed. We need all of them to have a stable, strong sense of self, to move towards a psychedelic experience without preoccupation and apprehension, and to then integrate that following when we come back into normal waking consciousness. So really what we're doing with the neuromeditation theory or neurofeedback in general is we're preparing the mind. We're making the set. So there's set and setting in psychedelics. And I argue that we could really do a lot more work with the set for individuals so that they can really establish that rapport, discuss their fears, outline the process, manage their expectations, clarify their intentions. And then we can also use the technology to assess the client's readiness or appropriateness for a psychedelic session. So coming back to this idea of how do we, dose someone and why, could we not use substances or not use EEG to help us best understand which substances someone is most likely going to respond to or not respond to? And I argue that yes, I think we can. I think with EEG and more depth of research around this, we can really assess readiness. And there are two EEG phenotypes that Jay Gunkelman and I and our team have identified as indicating that someone is not ready. And what I loved hearing in Ruth's talk is that we're all talking about actually it indicates that someone's not even ready for alpha down. So what makes someone uncomfortable with alpha down is likely going to make them uncomfortable with a psychedelic. And those two phenotypes are beta spindling and a fast posterior dominant rhythm. There are many ways that we can help these individuals through neuromeditation, neurofeedback, or even perhaps smaller doses of psychedelics, short-acting tryptamine, to start calming that nervous system to a point where they truly are ready to get into the water. So if anyone's not aware of what EEG phenotypes are, I'll just read this little excerpt. and you can go to this website to learn more about them. There's about 12. So identifying subtypes of specific disorders is an attractive exercise, as it expands our understanding of the individual response to therapy, but it remains attached to the approach based on the DSM, which is rooted in behavior and frequently does not predict therapeutic response by an individual within the DSM grouping. Phenotypes are an intermediate step between genetics and behavior. These proposed EEG phenotypes are semi-stable states of neurophysiological function. This author proposes a framework allowing one to describe much of the observed EEG variants within a small number of phenotypical categories. These groupings cut across the DSM categories, and unlike the DSM, phenotypes can help us predict the individual's response to therapy for neurofeedback as well as medication. And Jay has spoken extensively about his experience of using phenotypes to help determine which treatments are best, but also to really align individuals and psychiatrists with what medications have good outcomes. And Jay has been a wonderful mentor for me during this time. He's been working with our company extensively, and he's helped many of my clients modulate the medications that they're on with a lot of success by focusing on phenotypical assessment. So I would like to introduce you here to Dr. Sergio Perez. This is a picture of him in 2019 when I met him at Breaking Convention in the UK, which is a psychedelic conference. And he's an anesthesiologist. He works for Ovid, which is a ketamine clinic. Actually, he founded Ovid and the Mind Academy, which is a ketamine clinic in Berlin, and the Mind Foundation, which teaches psychedelic therapists different theories and how to work with clients. And his main statement is that in the emerging field of psychedelic-assisted psychotherapy, Dr. Perez thinks it is necessary to standardize procedures and educate professionals and the general public in a scientific and secular way to create a safe environment and legal framework for therapy and human development. And when we met, he was fascinated by this idea that I was there talking about how EEG, as an anesthesiologist, something he uses all the time, could be used within psychedelic sessions and could be used to standardize and educate and to, really help increase safety and avoid a lot of the negative potentials that can come from moving people into psychedelic states too quickly. So the company that I founded over COVID, Divergence Neuro, and the Mind Foundation have partnered. They are using our technology in their clinic, and they're also having us, myself and some of our German colleagues, because we now have a German Neuromeditation Institute as well as a Polish Neuromeditation Institute. We are teaching neuromeditation throughout the 2-year training for psychedelic therapists for their augmented psychotherapy training. So we are teaching the clinicians both to identify their own state and learn how to practice neuromeditation with themselves, and then how to work with their clients and to better assess where clients are at using neuromeditation theory and technology. Something that Dr. Perez also helped us develop is biomarkers and metrics for state prediction. So we have learned that if we take a patient and an EEG, that we have designed a specific biometric on our platform that will indicate, much like individuals, much like is used with anesthesiology to ensure that somebody is really unconscious before you do any surgery on them. We've actually found a way to do this with psychedelics, and we've validated this with DMT and ketamine so far. So this can be really useful in a clinic because it can help the clinician know when they need to dose their clients again. Are they still in the emergent state, or are they outside of that window? We met with Imperial College, and in particular Robin Carhart-Harris and Chris Timmerman, and they were open to sharing Chris Timmerman's DMT research with us. And that is part of the information that we use to design a lot of these metrics. So right now we're trying to design EEG analysis and subjective assessment, AI and machine learning based predictive biomarker modeling to really enhance drug treatment response, validation, and guidance. So on our platform, I will show you, this is Timmerman's data, and you'll see at 300 seconds when the infusion happens that the alpha band completely drops. That indicates that psychedelic state. And then very slowly, really around 1,000 seconds, alpha restores. So for an individual working with somebody, when they're doing repeated dosing, having a metric that shows you where the brain is specifically at could be very helpful. There are two measures of a psychedelic state, both Limpel-Z complexity, which is this one, and then the alpha drop. So we've also designed a metric to help measure Limpel-Z complexity. I'm very blessed and honored to have a wonderful team of neuroscientists and biomedical engineers and EEG engineers. I always say that I'm the race car driver, but those guys are definitely the mechanics. And it's pretty exciting that what we've been able to create so far. So the final stage, so now we've got, setting our set using this theory. We've got means of tracking during a psychedelic experience. And then we can also use EEG and neurofeedback for integration states. So Dr. Tarrant has done a ton of research in this area, and he has found that when we compare an EEG pre and post, and then using a calculation with Z-scores, we try to look at the difference in the brain. You can then customize trainings for that individual to support and maintain state awareness, flexibility, and the entropy that they gain from the psychedelic experience. So one of the challenges with integration is that individuals go back into the world and they're kind of really soft and flexible, and the impact of the world that they were trying to kind of get away from or heal from can be stronger. So if we are not only using the support of clinicians, but also EEG to make sure that it's about a 2-week period where entropy is strong, it's kind of like if you melt a candle, you want to make sure that when it hardens, that it's going to be in the shape that you want it to be in. So we're finding that if we use technology in this way, we can help maintain that shape that that client was really seeking, and it can help deepen their insights and move forward with the psychedelic, as opposed to continually going back for psychedelic experiences and really ending up on this kind of circular path that many do because they struggle with that integration practice or that integration period. Another thing that I think is really important is that we need affordable access to care, especially in the psychedelic renaissance. There is nothing cheap about how psychedelics are offered right now, and so it is not available to everyone. And watching Gabor Mate gave a talk once, and he says, yeah, well, psychedelics are valuable. It's kind of like using a ladle to empty the ocean on a rainy day. And I just really wonder if the neurofeedback community as a whole could really come in to increase affordable access to care. We might be able to pair neurofeedback with short-acting tryptamine, and people can have home training and using smaller, shorter sessions with licensed clinicians and actually getting the same impact as a big psychedelic session. They might even be able to integrate that easier, and we can educate them along the way. And it takes the mysticism away from psychedelics are the thing that save you. It's like, no, it's learning to relate to yourself in a new way is actually the thing that will bring you that grounded, therapeutic long-term outcome. I also would like to, and again, listening to Ruth speak, I think it's interesting that we're all on similar paths, and I think that everything that's gone on within Indigenous communities has really brought that to the surface, which is why we're all seeking to support these communities. In 2019, at one of my workshops, one of his students came to my class and he said, have you met Dr. Yellowbird? And I said, no. And he says, well, everything you're talking about neuromeditation sounds a lot like what he's talking about with neurodecolonization. So he said, there is a formula for decolonizing the mind. I refer to it as neurodecolonization. When one engages in ancestral contemplative practices to heal and restore the mind and body from the traumas of colonialism, that is neurodecolonization. Our entire self, down to the molecular level, can be affected by colonial situations, which can lead us astray and prime us for fear, doubt, confusion, and despair. Neurodecolonization restores an individual's self of well-being and contributes to resilience that results in healthy behaviors, thoughts, emotions, and actions that can enable us to transform our situation. So we've been talking for several years, and he's very interested in moving forward with some neuromeditation research. And we're hoping at Divergence Neuro to support him with that. So you can see these are a couple of his books, if anyone is interested in looking into his work further. Oh, I lost some of my slides. So I had some slides here that kind of talked a little bit more about the Divergence platform. And we essentially offer alpha down, alpha up, and all the other different neuro meditation modalities as easy to deliver protocols. We've also made it web-based, cloud-based, and the headsets are dry sensors that clients can rent or purchase and then use with an app on their phone. I have about 15 clients that are on the platform right now, and I have noticed really, really wonderful effects.
But I found this platform super buggy.
And the biggest thing we're trying to do here is really, like Ruth said, disseminate neurofeedback and make it more accessible. So if anybody has any questions about this, I'm looking forward to talking to you about them.
So they going to?
Yeah, they said they
slide.
These are the people who was like they when they was.
I'm sorry, there's somebody actually is not on mute. Carly, I think we can hear your conversation.
Sorry.
Yeah.
Problem. So thank you. I'm going to leave us with one quote.
Hello, Heather.
Rustam, can you please, Rustam,
Yeah.
can you please hold on and put your hand up later? Just a second, let Heather finish.
Okay. Oh, sorry.
Thank you. Just put your hand up, please.
Well,
I appreciate the enthusiasm, though. So there will come a time when a disease condition will not be described as it is today by the physicians and psychologists, but it will be spoken of in musical terms, as one would speak of a piano that was out of tune. And I think that as we move forward and hopefully merging the psychedelic renaissance with maybe a renaissance in neurofeedback as well, maybe we will start reframing disorders as more of a brain health challenge, something that we can help people develop more mental fitness instead of labeling them with pathologies. Thank you.
Thank you, Heather. That was absolutely wonderful presentation. And I think a lot of us on ANSA board want to be subjects in your research. So please go ahead and enroll us. I know
have made it easy.
I think just this whole, integration of neuroscience and psychedelics is just beautiful and quite elegant way of assisting people. And I always think if we loved ourselves more and being much more in tune with lovable sense of self, that's a recipe for the world peace, I think. Not as simply, I don't want to make it simplistic, but still, thank you so much. I know we're running out of time because we're supposed to start our break, but let's allow for a few questions. I know it's very important that you put your hands up, so rather than, just talking. So I know Rustam wanted to ask something. Please go ahead, Rustam.
Oh, great. Hello, Heather.
Hi. Good to see you.
Remember me? I interviewed you. I just shared your interview actually there on YouTube, still on YouTube. That was amazing. Yeah, it's fascinating stuff that you're doing. I've been doing the holotropic breathwork for many years in Russia. Unfortunately, Russia seems still behind in the developing the consciousness. But I try to implement it in Australia, and it's not an easy thing to do, especially the hallucinogenic substances are still prohibited, even though there is a lot of research happening in Australia. But holotropic breathwork seems like offering some kind of solution that is less dramatic in terms of this permissions. But there's a lot of resistance in understanding holotropic breathwork, how it needs to be applied. So your method maybe could help.
I am speaking with the holotropic breathwork folks. We have been discussing ways of also using this technology to prepare people for holotropic states, and then potentially like, assessing what's going on using some of the metrics that we've designed.
Yeah. Another thing is, okay, so from top-down approach, okay, it's all about love and experiencing the amazing high order cognitive functions. But what about bottom-up approach? A lot of people have different epigenetic issues, and they need the primitive reflex work because they were born and experienced. Yeah, how do you integrate those?
Well, that's where we use more of our somatic focused practices. And again, I'll use like the diagnostic of just watching, like how sensitive are they to an alpha down or an alpha up protocol, and can they discern that, which gives me a sense of where they're oriented in their sense of self. And then I can kind of, there's some clinical skill that comes with this to then decide where somebody needs to go. And it's always collaborative too, right? We work together to see what's working and what's not working. But different protocols, like a lot of the body-oriented pieces, are we body-focused, or are we trying to open focus into that more mindfulness state, and seeing how someone discerns those states can be helpful too.
So you can give specific instructions to the clinics who want to incorporate a bit more intense breathing techniques together with neurofeedback?
Yep.
Okay. Yeah, okay. That'd be really good.
And the portability of kind of what we've designed here has made it easy for people to start doing experiments. And we've been working with quite a few people in the psychedelic field. Our team supports a lot of the research initiatives. We've analyzed a lot of the data, and we've analyzed some of the protocols they're going through, and then we see what insights have come from the different research initiatives.
Great. All right. Well, thank you very much.
Thank you.
Just quick question, Dennis, because we well and truly over time.
Okay. You mentioned open heart, and I've done the training with the Heart Math Institute, and of course that links into heart rate variability training, which is a biofeedback device. I was wondering whether you've looked at heart rate variability training and integrating it with the neurofeedback.
So that is on our roadmap at this time to integrate. So our platform, the whole point is to be hardware agnostic. We are not affiliated with one hardware at all. We have made the platform that eventually we want to let clinicians pick and choose, and researchers pick and choose which technology they want to put together. So, I kind of lost my, hold on, let me see if I can show this slide. There we go. These are the two headsets we have on the platform right now. So there's the Neurosity Crown and the BrainBit. BrainBit has their main one, and they just came out with one called Mindo. So Mindo is $320. You get T3, T4, O1, O2. The Neurosity Crown is $1,000, and then we have like 8 sensor sites. The Neurosity company has agreed to allow us to work with them on a rental model. So clients can rent the Crown for up to 3 months for $100 a month while you're working with them, and then they can just return it. If they like it, they can then choose to purchase, or they can rent indefinitely. The other one that just came out that is really exciting to me, we just released this at the end of September, is a cap that has 4 sensors that are movable. So you can hit all the different 1020 sites with this cap, dry sensors, the client can do it at home, it's all app-based. So we not only have the neuromeditation protocols on our platform, we also have an entire suite of just, it's basically like Eager at this point. We haven't added Z-score or Eslaretta due to sensor limitation, but we're getting there. So you have an entire neurofeedback platform that you can work with and design your own protocols as well.
Thank you, Heather. Thank you so much. That was beautiful.